Imagine if every athlete never got hurt or injured while doing a sport. Well, that will never be that. Many student athletes never think of the outcome from doing sports. The only thing that is on their mind is becoming the fastest or strongest athlete, and that's not going to change anytime soon. Sports injuries have increased rapidly since previous years, and it is currently a major part of many athletes' lives today. Playing sports and doing regular exercise are good for our health, sometimes result in injuries. This is unavoidable because of doing inappropriate things and techniques in playing a particular field. Almost any part of the body can be injured, include muscles, bones, joints, and connective tissues. The ankles and knees are some of the most commonly affected areas. So now, we are going to show how injuries could happen in playing basketball and how do we prevent this kind of injury. Here we go! First, fracture is when you break or crack a bone. It can be on the neck, shoulders, elbows, chest, knees, and ankle. It is one of the common injuries when you play basketball. To prevent it, you can take a time off, wear the right gear, strengthen muscles, increase flexibility, use the proper technique, play safe. Do not play through pain. A muscle strain or pulled muscle occurs when your muscles is overstretched or torn. This usually occurs as a result of fatigue, overuse, or improper use of a muscle. Strains can happen in any muscle, but they're most common in your lower back, neck, shoulder, and hamstring, which is the muscle behind your thigh. To help prevent muscle strains, warm up before participating in sports and activities. Follow an exercise program and aimed at stretching and strengthening your muscles. Increase the intensity of your training program gradually. Maintain a healthy body weight. The third one is concussion. A concussion is a mild traumatic brain injury. It can occur after an impact to your head or after a whiplash-type injury that causes your head and brain to shake quickly back and forth. To prevent concussions, you can reduce the risk of getting a concussion by wearing a correct helmet and other athletic safety gear during sport activities. Fourth, if you have dislocated your shoulder, your upper arm bone has moved out of your shoulder's joint. This is the most frequently dislocated major joint of your body. Dislocation is often caused by a significant force that separates your shoulder's joints ball from your joints. To prevent a dislocation, exercise regularly, maintain strength and flexibility in your joints and muscles. The last one is a strain. A strain is an injury to a muscle or a tendon, a tissue that connects muscle to bone. In a strain, a muscle or tendon is stretched or torn. Sprains and strains can happen suddenly or develop over the course of days, weeks, or months. When a worker is exposed to causative risk factors, they are more likely to develop a sprain or strain. Preventing sprains and strains in the workplace requires a simple strategy. Reduce all causative risk factors by implementing controls, both ergonomic and individual controls. Fostering a culture of prevention at your facility is the best way to achieve prevention excellence.